everyone. My name is Fumlayo Makonjola. Welcome on my program, Sheke. I'm so excited to welcome you guys on this program. This is a program where we'll be calling different medical professionals. They will be exploring on different health issue. My people, I know you will enjoy this program. Call your neighbor, tell her to call her neighbor to enjoy this program with you. And don't forget to follow me on Facebook, on TikTok. On Facebook, Fumi Sheke. On TikTok at Fumi_Sheke. And today also my guest is here with me. Good morning. Welcome on my program, Sheke. Today, the way we used to do, you will tell my viewers your name, your profession, and what you want to discuss with us today.
Okay. My name is Dr. Suleiman Hassan. I'm a dentist. Our topic for today's discussion is oral cancer.
Okay, sir. Can you just give us a brief introduction to oral cancer?
Right. By way of introduction, cancer is a form of disease that arises when an abnormal cells grow uncontrollably in the body and tends to spread to other part of the body, causing tissue destruction. I mentioned an abnormal cell.
Okay.
Generally, cells are the building blocks of our body. Our body is made up of cells, and there are various types of cells. These cells are designed to carry out specific functions. Example of these cells are the cells that arrange themselves to provide the skin covering, the
Okay.
integrity to maintain the integrity of our skin. We call them epithelial cells. This same category of cells that line our skin also do that to line our oral cavity. This is just an example of the cells. And
Okay.
as we shall be discussing how a normal cell becomes abnormal, is a very complex process, and we shall be discussing that as we move on with our discussion.
Who are the people or age group that this mouth cancer affects?
Okay. Mouth cancer actually affects all age groups, but it's commonly seen in people that are over 40 years of age.
Okay.
The peak age of incidence is actually sixth decade of life, and there are people that have that we call them high risk population. These are people that abuse tobacco, alcohol, and some form of genital sexual practices,
Okay.
because some viruses have been implicated in the formation of the cancer. And male tends to be more affected than female.
Okay. But how can somebody now develop this mouth cancer?
Okay. The process of formation of mouth cancer is actually a complex process,
Okay.
from the spectrum of normal healthy mouth to full-blown cancer. It's something that happens in stages, but the overall mechanism entails what we call genetic mutation. For example, a cell that is healthy, a normal healthy cell, when it comes in contact with carcinogens, these carcinogens are substances that have the capability to elicit, to initiate formation of cancer. When it comes in contact with this carcinogen, will now cause alterations within the cell,
Okay.
particularly to the genetic material of the cells, that's the DNA. This DNA is what carries the information as to what function the cell will be able to carry out. This same DNA carries the information that is being passed from parent to offsprings. When these carcinogens cause alteration in this genetic material, it leads to what we call mutation. It means the cells is now abnormal. The overall effect that brings about the initiation of this cancer falls within one of two events. Either this mutation causes the blockade of normal intrinsic mechanism of the body
Mhm.
that gets rid of cells that are abnormal. We call them tumor suppressor genes.
Okay.
Either this genetic mutation blocks this
The normal one.
mechanism,
Okay.
or it enhances a mechanism that promotes the expansion or the continued multiplication of these abnormal cells. We call them proto-oncogenes. So the
Okay.
overall thing that happens is either suppression of the mechanism that that eliminates the abnormal cells, or it promotes the mechanism that enhance the multiplication and expansion of these abnormal cells. which eventually leads to cancer.
Okay. What are the causes of mouth cancer?
The causes for mouth cancer is actually multifactorial.
Okay.
Like no single cause has been identified, but complex interplay between risk factors and individual that is genetically predisposed. Genetically predisposed individuals are people that are more prone to develop the disease than other category of people.
Okay.
So these risk factors include tobacco usage, alcohol consumption, and recent studies, some viruses have also been implicated in the development of mouth cancer and even throat cancer. These viruses traditionally have been known to cause cervical cancer, but probably due to changing trends in genital sexual practices is because of this new development. As for tobacco, the International Agency for Research on Cancer highlighted that there are more than 55 carcinogens in tobacco smoke. Carcinogens are chemical compounds that have the capability to initiate formation of cancer. And in combination with, they have synergistic effect between tobacco and alcohol. That is to say, the effect when someone uses tobacco and alcohol at the same time is times over than using either tobacco in isolation or alcohol in isolation. So these are the risk factors. When combined with someone that is genetically predisposed to develop the disease, then that is how mouth cancer arises.
Doctor, in your explanation, you mentioned of tobacco. What type of tobacco, the form of tobacco that you are talking about? Is it all the tobaccos or there is a specific tobaccos that you are talking about? And the secondly, you talk about alcohol. You know, some people like taking stouts or this. Is it any form of alcohol too or a pure alcohol? You know, there's a sachet alcohol that they are selling. Is it that one you are talking about or general alcohol?
Okay. As for tobacco, there is no safe form of tobacco of any form, regardless of the flavor being added to it whatsoever. Tobacco of all forms, including the one you smoke, the smokeless one, the smokeless one, including shisha,
Okay.
including powdered tobacco,
Mhm.
the moist and dried snuff. And there are other forms of tobacco that are not common in this our locality, like areca nut and betel quid. That one is more popular in Southeast Asia.
Okay.
But tobacco of any form is actually a risk factor, a very great one. And what alcohol does is it mostly works synergistically with tobacco.
Okay.
What it does, alcohol itself has contaminant in it, and it also serves to enhance the solubility of those chemical compounds capable of initiating cancer. The alcohol now solubilizes them and enhance penetration of these chemical compounds into the cells that leads to the alteration that eventually leads to cancer formation. And alcohol uh, is actually uh, frequent alcohol usage, like 3 drinks per day,
Okay.
like 3 drinks per day, not
Mm.
just a sip,
Okay. Okay.
but
Okay. Like somebody is taking it every time. You know, some people they are addicted to the alcohol.
actually research shows 3 sips per day is significant, but
Okay.
it's actually better to avoid
Okay.
the alcohol.
Okay, sir. Sir. But what are the signs now? The signs and symptoms that somebody will be seeing and know that this thing is happening to me is a mouth cancer.
Okay. Actually, you see, most patients seek dental care only on account of pain. This is
Mm.
very unfortunate, actually, because most of the initial symptoms are without pain. This means that most of the patient that comes actually present the late stage of the disease. This is very bad. Some of the symptoms that actually can signal mouth cancer: when you have a mouth sore that is over 14 days, that is not healing.
Okay.
Sometimes even when you have tooth that is shaking. Sometimes when you're
So
losing,
okay, when the tooth is shaking just like that. Like nothing happened to the tooth, it's
Yes,
just shaking like that.
tooth
Okay.
can be a symptom. And when you can also notice that you're losing weight. Sometimes you have difficulty when you want to swallow. Sometimes you have pain when you want to swallow. Sometimes you can even have pain around your ears. You understand? But these are actually symptoms that can be with other conditions, not just mouth cancer.
It's true.
Okay,
It's true.
these are also these can be seen in other conditions.
But it's better they should come to the hospital.
Exactly, exactly. These symptoms can also be seen in other conditions. And after this, there are the advanced stage of the disease, as I
Okay.
mentioned in the introduction,
Sure.
that the hallmark of cancer is after the formation of the cancer in the primary site, it tends to spread to other part of the body and cause destruction. Some patients actually present with what we call metastasis. That's the cancer cells have now spread to other part of the body. Commonly, cancers from the mouth spread to the lungs, then to the liver, and to the bones. So patient can come with symptoms that signifies that something is going wrong with these other organs I mentioned.
Okay, sir. But for example, now let's just accept that somebody have it and the cases are severe. Can the treatment be done for the person? Is there any treatment that can be done for the person?
Basically, oral cancer, you see, it has one of the highest mortality, even two times the mortality rate is even two times that of cervical cancer, because up to like 5%, uh, up to 5 out of 10 patients that are affected eventually die of their own disease within 5 years. Okay, the treatment modality actually, uh, the treatment and the outcome of the treatment depends on how soon
Okay, the
the
person
patient
come to the
comes to
hospital.
the hospital.
Okay.
Generally, the treatment protocol is surgery, combination of chemotherapy, use of anti-cancer drugs, and radiotherapy, use of radiation to cure
Okay.
the cancer.
All right, sir. Well, how can somebody prevent now that, okay, for example, I want to prevent this mouth cancer? What can I be doing?
Okay. The good thing about mouth cancer, 90% of mouth cancer is actually attributable to causes that can be prevented.
Okay.
These are tobacco use and alcohol ingestion. So means of prevention should now target individual and mass education through social media like your own, through media, understand. Another thing is having to go for screening. The American Society for Cancer recommends a thorough screening for oral cancer be done on individuals that are 20 years to 39 years of age every 3 years. And this same screening to be done annually on individuals that are above 40 years of age. Understand? And this screening can also be done on population that are at risk, even if they are below 20 years of age,
Okay.
particularly population that abuse tobacco and alcohol. And another way we can actually prevent is through government policies that discourage, eliminate, or reduce the risk factors. Understand? And through making healthcare accessible and affordable to everyone, including underserved population. This would encourage them to come to seek care on time, as the early detection of this mouth cancer has been linked with the outcome of the treatment.
Thank you so much, sir. I really appreciate you for coming on this program. I know people have learned one or two things in this topic. Please, my people, I want you to be visiting dental clinic. Dentists, they are your friends. If you notice these signs that we mentioned before earlier, just try to come to the hospital. Check yourself. Early detection, it make the treatment to be easier for you. Thank you so much. I will see you in my next video. Bye.